Well, aloha. Happy Aloha Friday. Thank you so much for joining us here on Spotlight Hawaii. I'm Yanji Denise, joined by Ryan Kalei-Suji. And Ryan, today we've got a double header.
That's right. We're going to be talking to two guests. Our first guest is going to be the Director of Public Safety, Max Otani. He's going to be updating us on what's happening with our prisons. We know that COVID and the outbreaks that have happened there has been concerning to many in our community. We'll get an update about what's happening there. And later in the program, we'll actually be speaking with David Matlin, the Athletics Director for the University of Hawaii. He's going to update us on the developments of the Clarence T.C. Ching complex, as well as the announcement that just came out today regarding season tickets for UH football and how they're going to manage that with limited seating capacity. So a lot to get to. Let's first bring in the Director of Public Safety, Max Otani. Thank you so much for joining us. We know that you have only been on the job now for, I believe, about 6 months, so fairly new to this. Let's just start off there. How have things been like with you in this new role? We know the previous director had been there for some time, Nolan Espinda. He had some criticism by those in the legislature, ultimately decided to retire. You're stepping in here. How has this first 6 months been like for you?
The word that I use is challenging. It's been very challenging, the 6 months. It seems longer than 6 months because we've been really busy, especially with this COVID outbreak.
Yeah, well, let's talk about that. What are you doing to mitigate COVID in the prisons itself? I want to sort of get some numbers from you in terms of the rate of vaccinations among inmates. How many inmates have been vaccinated, and what's the percentage at this point?
Okay, so I think we need to start from the beginning. So, we started up with the pandemic plans. We have our pandemic plans for the facilities. We also increased our PPEs. So staffing, inmates, PPEs are very important. Screenings, both staff and inmates. We do a lot more testing than we did, let's say a year ago, for example. So, we have all these different protocols in place that we did not have before. And the vaccine itself is what I call a game changer. We had high hopes that, with the vaccine, we would be able to keep COVID under wraps, but acceptance of the vaccine is another issue.
Yeah, let's talk about that a little bit more. We know that there are, those who work in the facilities that are reluctant to get the vaccine. How many of your workers that work in these prisons, in these close quarters, are vaccinated? And of those that you're speaking to that have chosen not to, what are you hearing from them in terms of hesitancy as to why they don't want to get this vaccine?
Okay, as far as the actual numbers, we don't have actual numbers. We were able to keep some numbers early on when the vaccination pods were at our facilities. So we were able to track the employees that actually were vaccinated. But many of the employees now go out on their own to various pods out into the community, and we don't have access of that. Early on, when we provided vaccine, and we started back in January of this year, we were looking at about 30% at that time. I'm not sure what the actual numbers are at this point.
And those are staff numbers, not inmate numbers, correct?
Correct, that's staff numbers.
Do you have a sense of, even just a rough percentage of how many of the inmates, especially those who are there for extended period of times, have been vaccinated?
We don't have percentages because it's really hard to keep percentages on inmates because they come and go and they transfer to other facilities. But we do have numbers that we provided, early on as far as how many inmates that did receive at least their first shot.
And moving forward, is that something that your department will continue to do? Will you have maybe vaccine days where you'll have people coming in to deliver vaccines? Is that going to be something that continues to be a priority in the prison system?
Yes, it is. Vaccines are still being offered to inmates. They come in regularly and offer. Some inmates were offered multiple times. At the smaller facilities, especially when they go in for the follow-ups, inmates are always offered vaccines, even if they initially refuse.
There was an article in the paper earlier this week talking about the new recruit class, and I believe it was out of 40 members of that class, 36 had refused the vaccine. As an employer, that has to be pretty tough. We know that at this point, you're not mandating that, but is that something that you're looking at as a condition of employment, that you would have to be vaccinated to work in the system?
If legally I could, we would. But at this point, because the vaccine too has not received full approval from the FDA, it would be difficult for us to mandate this. We are looking at it, from the legal perspective, when the vaccine gets full approval, to see whether or not we can mandate this for staffing.
When the outbreak first began and when we started hearing about the pandemic, of course, there was concern about the prisons because of the already issues of overcrowding that was happening in Hawaii's prisons. How much of overcrowding and the lack of facilities that we have here in the state has contributed to the outbreaks that we have seen with COVID-19 in these various facilities?
Okay, so I guess the three principles: washing your hands, masking, and social distancing. We can do the first two in prisons, but the social distancing is impossible, especially with overcrowded facilities. So we've developed plans, and the staff have actually implemented these plans pretty well to quarantine people, because in addressing the COVID situation in the facilities, it's basically detection and containment. We need to find them, we need to identify these people and keep them separate from the staff and inmates that are negative at this point. So it's staff has done a terrific job in identifying these situations. Currently, we have 4 active inmate cases. We have 2 at OCCC, 1 at Halava, and 1 at Maui. And we were able to contain it because staff caught it at intake. Testing is done, and staff is getting better at screening inmates. So they were actually detected at at intake, and was able to contain them and isolate these cases.
Tell us a little bit about that. So an inmate, someone is sent to one of your facilities, they're screened at the time of entry, but once they're in the general population, people can take a few days to present symptoms. What are you doing with the existing population in terms of screening? Are people tested at random on a regular basis, or how are you making sure that outbreaks and clusters don't happen?
Right. We have medical staff that does periodic checks, at least daily checks on the housing units. Inmates are encouraged, if they're feeling sick at any time, we waive the copay. There's a copay for medical. We waive the copay if you had any symptoms of COVID to allow inmates to increase the reporting if they do feel sick. And of course, the testing portion that comes into play.
I want to get back to just the overall issue of overcrowding, because we know that continues to be an issue. What steps are being done to help alleviate that? We hear of plans to expand some of the facilities that are already in place, but that could take some time. What are things that your department is working on to help with just the overall issue of overcrowdment in our prisons?
Okay, let's first talk about the Supreme Court. Supreme Court, I guess came out with an order to, curb the intake at the jails, which, helped us a lot in reducing our jail population. Recently, that order was lifted, so we expect, more inmates and detainees to come our way. But that helped, to reduce the population in our jails. As far as future plans, we're still proceeding with the planning and hopefully the building of the new OCCC up at the Halava facility. Not at the Halava facility, but it's actually at the Halava Animal Quarantine Site. And in addition to that, we have expansions for inmate housing at HCCC, MCCC, and WCCC at this time. And it should assist with the overcrowding conditions.
What's the time frame for those projects? When do you actually expect to feel the benefits of those?
I think as far as all the projects, WCCC will probably see the earliest benefits in approximately 2 years, I believe. The the big project at OCCC, it's still in the planning phase. You know, we haven't even issued an RFP at this point. We're still taking proposals, you know, for interest at this time. Or we closed the interest and we're reviewing the interest proposals at this time.
And so it will take some time for there to be, of course, for us to see more beds and more just the overall growth of these facilities. And we know that in the past that prisoners have been sent to places like Arizona. What is being done on that end as well? If you can expand a little bit more about transferring these prisoners to out of state, what is being done to also protect them in those facilities, of course, as COVID-19 continues to remain a threat there as well.
Yes, we have 1,075 inmates at Arizona currently. We have 11 at, I believe, the FDC. So we utilize, you know, both contracts to assist with overcrowding. The Arizona situation, they began offering vaccines to inmates there. Just recently, I was informed that they began offering vaccines to people that are 18 and older. So initially it was 55. So they went through the inmate population and offered the vaccine to inmates that were 55 and older. But recently they opened it up to 18. But they're under the control of the Department of Health in that county. So supply and demand will dictate how fast we can get all the inmates vaccinated there.
Is the goal to try to keep more of those prisoners here in Hawaii? We know that it's so important when a prisoner re-enters the community, when someone is released, that they have those family ties. Those ties are obviously very hard to maintain if they are in Arizona or another facility on the mainland. What's being done to try to keep more of those folks here so that when they do re-enter our population, they have support?
Right. We have a plan as to who goes to Arizona. My plan is to fill the Hawaii biz as much as possible, and we'll utilize the Arizona biz as needed. Unfortunately, with the pandemic, we needed to create some space so that we're not fully overcrowded, and we have that ability to quarantine people, enough space to quarantine people and isolate people in the event that we needed that space in our facilities here.
You know, at one point there was talk about the state utilizing and finding ways to take over the federal prison that's over by the airport. What can you tell us about what's happening with that facility? Is that something that is still in consideration at this point in time? And what information, I guess, can you provide us on that?
If we could buy a ready-made facility, that would be great. But, of course, there's also the cost of money involved, whether or not, and there's also the fact that whether or not Bureau of Prisons would sell that facility to us. So, it's something that we can put on the wish list, but I don't think anything is happening at this point.
Going back to the issue of, maintaining strong ties in the community, we know early on in the pandemic that visitors were limited in terms just to try to keep COVID out of the prisons. What can you tell us about what's happening with people being able to visit their loved ones?
We have not opened actual direct visits yet, to families to come in to visit inmates. We are in the process of looking to see how we're going to reopen. We're looking at community spread. We're looking at vaccinations, and we're planning to come up with a plan as to, we're working on a plan and probably implement the plan within the next month or so to open up facilities for visitations.
If I could just follow up on that, what would you be looking at? Would you perhaps require family members to be vaccinated in order to visit? Or, some of these prisoners, obviously, they haven't seen their loved ones in over a year, and that's got to be pretty tough on both sides of that equation.
Right. Yeah. So vaccination would be one thing that I would strongly encourage. Also, several of our facilities have no contact visits where they have barriers. So that is also another possibility. Screening, like staff and inmates that come into our facility, we're going to have to be very diligent on screening and, visitors that come into our centers.
Overall, as you have managed through this pandemic and as you've tried to put out all these fires that, of course, have been coming up and popping up with the outbreaks at the facilities and things that have been happening with the workers, what are some of the challenges that you feel the department continues to face? And what are you looking at as someone who's leading this department now as making your priority, what are maybe some of those top priorities that you want to really focus on moving forward in your role?
Okay. Made no, I've never covered up, but the most important thing in our department is our staff. And without proper staffing, this department cannot move forward. So we're making a very conscious effort to fill these positions. We're fortunate that the legislature, was cooperative with us during this session. So we're making, we're actually doubling up on training. So the training numbers that you saw at our training center, it's basically a double training that we're doing now. So we need to get people into our facilities to fill these vacant positions so that we can do the work that we need to do. Corrections officers, is a very important job. We also need to start looking at, the programmings. We need to start looking at what is the new normal. Everybody's talking about the new normal, but as far as corrections, how we did treatment classes, how we did educational classes, all of these things need to be revamped, and we're working on that, with distance learning, smaller classes, but these are things that we're working on right now to try to find a new normal within the department.
There are some questions. We have some viewers writing in, and they're just asking about those programs specifically. I'm interested to know how, drug treatment programs, for instance, that's something that someone is asking about, how that's been, how those programs and the other ones that you referenced, how they've been impacted by the pandemic, and what you're hoping to do moving forward.
It was impacted, and basically things were shut down for several months. We have programs, I believe Arizona slowly started opening up again, and we have programs within our state facilities that are slowly opening up. Unfortunately, with social distancing, we cannot have the numbers that we had before because of limited space within our correctional facilities. So we're trying to start these programs up again, and some of them have started, but at a slower pace and a smaller population within these treatment programs.
As our time here with you wraps up, I wanted to allow you an opportunity, maybe just to speak to those who are watching who have seen the headlines, of these outbreaks that are happening in the prisons. They're seeing the vaccine numbers and that hesitancy there. What would your message to the public be about the state of our prisons right now and the role that your department plays in making sure that the inmates as well as the staff members are protected moving forward?
Well, I think, again, I would have to credit the staff within the department for doing a great job. We had staff that tested positive recently, but, they acted quickly to prevent that from spreading into the inmate population. There were 3, I believe, facilities where, correctional staff did test positive recently within the month, but they were able to contain it and not introduce the virus into the inmate population. So we were fortunate that, staff acted very quickly and diligently to prevent that from coming into the facility. My hope is that everybody who can take the vaccine, take the vaccine. It's not just for you, but it's for your family and, your coworkers out there. Understand, it is a personal choice at this time, but I think for me, the benefits, outweigh the negatives at this time.
Thank you so much, Max Otani from the Department of Public Safety, for joining us and spending some time with us this Friday. We know that this is an area that a lot of people have a lot of interest in, and we really appreciate you spending so much time with us this morning.
All right. Thank you.
Thank you. Thanks. All right, great to hear from him and an update about what's happening there in the prisons. As you heard, they were able actually to contain a few of the outbreaks that after inmates as well as workers tested positive. And they continue to work hard to make sure that those who want the vaccine are given the access to do so.
Yeah, and they are in kind of a bind. He did say legally, and it's not just him, obviously, all employers are trying to figure this out. They can't mandate the vaccine because it is under emergency use authorization from the FDA. But they're, obviously, given that he says social distancing is very, very difficult in his facilities, he's really trying to encourage his staff and the inmates to get vaccinated. He did say they have 4 active cases in the prisons right now, spread out across several facilities. They are doing their best to quarantine those folks and make sure that those don't turn into clusters. So they're, monitoring people at intake, but it is very difficult to to keep these under wraps. And the other thing that he pointed out that we want to make note of is just that these prisoners for so long have not had access to their family members. These visits have not been happening, and we know how detrimental that can be on both sides. You have parents in there and their kids can't come visit them. And, those community ties are so essential, because when those folks do get released, it's very important that they have a network of support. So the prison, he said that they're working within the month to try to release a plan so that they can reestablish that, and also the treatment programs that he talked about.
Yeah, we'll continue to stay posted on the developments that happened there and bring you any more information as that comes about. We're going to switch gears now and move over to athletics. Joining us from the University of Hawaii is Athletics Director David Matlin. Thank you so much for joining us. David, want to first start off, there's a lot happening there on the lower campus. Not only did you guys just, the national champions being brought home, but also some developments that are happening on the Clarence C.C. Ching field. If you can update us on the developments that's happening there.
Yeah, well, obviously the men's volleyball national championship was exciting for our whole community. I think, as Charlie said it wasn't just for the fans, it was because of the fans. And I think that's a very true statement. So that's kind of uplifted us all. As far as, the Clarence T.C. Ching Athletic Complex, construction's going on. 2 days ago, the Mackay grandstands were put in a container, and it's headed to Hawaii, which is exciting. We're a little ahead of schedule. It doesn't mean that don't go to bed being a little concerned every night, as we're learning stuff every day, but we're on schedule, and excited about the renderings that we've just released also. So moving forward.
So we saw the article today in the paper, and we know that there are not going to be as many seats as there are season ticket holders. How are you navigating this? And for folks who want to come see games in person, and we know there are a lot of them, what should they know?
Yeah, well, we have approximately 16,000 commitments when you look at students, our visiting team commitments, our season ticket holders, and contractual obligations. We're anticipating having 9,000 for the first year, so the numbers don't add up. So what we come up with the plan is to be as inclusive as possible, where there's a priority system that involves a couple factors, your age club membership, as well as how long you've been a season ticket holder to kind of rank you. And we're also holding some seats back, knowing that not everyone's going to be able to get season tickets. So we're holding some back so we can kind of take care of as many season ticket holders and committed tickets we have, with at least maybe 1 or 2 games, after we go through the season ticket portion. Our mantra kind of is be as inclusive as possible and be as transparent about the process.
And so what does that look like? Because you said there are obviously more season ticket holders than there are seats available. And so if someone is an H Club member and a season ticket holder from 2019, then they would be given first crack at seats, or how is that going to be prioritized?
Yeah. What they would do is buy their H Club membership and how long they've had their season ticket holder. That would rank them on the priority system for getting seats. That would give them the ability to buy some seats. It might not be the same amount they had before. I mean, you could have had 8 before. That might only qualify you for 4. But that's part of our message about being inclusive, at least giving as many people as possible some access.
And so to follow up on that, if I can, Yunji,
please.
Is there a tier system within that? Because there are different levels, I believe, in that H Club network. And would, if you can kind of expand upon, if you donate a certain amount, you're moved up to a different diamond level, or something like that. I mean, what are the tier system within that? Yeah,
there's like 7 levels of the H Club, and we sent out the letter to season ticket holders. They should be getting it today and tomorrow, maybe Monday, and it will tell them where they're at right now. They have till June 7th to upgrade their level. But once you get your level, whether say you're at the captain level, and what happens is we'll take all the captains and then we'll look at how long they've had their season ticket holders to prioritize it within each level. Does that answer your question?
Got it. Yeah, got it. Okay.
So are you thinking a lottery system, or is it just pure rank?
It's rank. It's rank, and then we'll reach out to those people. They'll pick their seats, and we'll see how far we get down. And like I said, we are holding some seats for the season ticket holders or the committed tickets that might not be able to get, so we can maybe at least give them 1 or 2 games afterwards.
And what about, we know that, of course, the student attendance has been pretty low at Aloha Stadium, but now that we're moving on campus, that could be an entire population in and of itself of students that now can easily access the facility and be at the games. Is that being factored in as well?
No question. Our student commitment is 10% of our capacity has to be for students. for students. So if you're about 10,000, that's 9,000, roughly 900 to 1,000 tickets. So yeah, that is a hard commitment that we're going to honor, and that as well as we have visiting teams coming. For visiting Mount West teams, you're between 300 and 400 seats that you have to honor for them too. That's a league commitment.
It's so important for the university's bottom line to sell season tickets. And are you concerned that some people might say, well, I'm not going to get a seat anyway, I'm going to skip this year? How do you make sure that you maintain that relationship with the fans, knowing that, at some point you will have enough seats?
Yeah. I mean, and that's why we're trying to be as inclusive as possible, to give the opportunity to at least go to a game if they can't get all the games. And a lot of it is just communication. I mean, we're coming out of COVID. Demand's going to be a little different. And also next year, our anticipation is our goal for year 2 is to get upwards to close to 15,000 seats. And then we should be in better position to take care of most of our season ticket holders. But we got to keep people engaged. And that's why our mantra is be as inclusive as possible and really be transparent and just communicate with our fans.
We know that COVID has obviously impacted the way in which fans can interact with the team, and just being in attendance. I believe that this weekend will actually be the first time that some baseball parents and friends will be able to watch the senior game going on there at Les Morecambe Stadium. But moving into the fall, we're talking about these tickets, but how is COVID-19 being factored into this planning? Are there going to be any restrictions with social distancing? I mean, what are the measures you guys are taking looking at fan interaction?
Yeah, well, it's one thing we know about COVID. The protocols are going to direct us to make adjustments possible. We have to have a plan for all seats, and then we're going to have to adjust based on the protocols. I'm somewhat optimistic that we're heading in the right direction with the virus. I know even California's doing much better as far as looking at having full fans. So we're hoping for the best scenario, but we'll have to adjust as we get closer. And obviously, there's more work to do on that because we have to follow all guidelines, the city and government and NCA, but I think we're trending in a good direction, but we have to plan for success, and then we're going to have to adjust. We don't know what the specifics will be at that time. We've been through so many different protocol tiers, even in athletics as well as the city. So we just have to be agile.
We know that the university system has joined many universities across the country in mandating vaccines for their students and encouraging it for their staffs. What is the policy when it comes to fans? Are there any plans to? I know that I was reading recently that Lollapalooza is happening this year in Chicago, and they are going to have either a COVID vaccine requirement, or you can have a COVID negative test requirement to attend that concert. They're expecting 100,000 people, so it's a totally different scale. That said, would you look to adopt something similar at a smaller scale, given that, as Ryan pointed out, we've had such limited fan interaction, and when you bring all those people together, there are some risks?
Yeah, that's a great question. We're working through that right now. Those are discussions we're having about what the best manner to do it is. So I don't have an answer to that, but that's definitely a topic that we're discussing about the best way to return fans. And the good thing is you learn from best practices, what's going on in the summer and other locations, and then you adjust. So that's something that we're meeting with the university administration, and we're making those decisions. And obviously we involve all the proper authorities in those decisions.
This is, of course, when the news of Aloha Stadium came out, it was worrisome. But, since this announcement has been made, there's been a lot of excitement, actually, about the team being able to play on campus. If you can take us through what you think realistically that game day experience will be like, because it will look a lot different than what fans were used to at Aloha Stadium with tailgating happening. That will all be obviously a lot different being on campus. What are some of the things that will be different for fans as they experience football games on campus this year?
Yeah, well, it's obviously going to be a more intimate experience, with 10,000 seats. Being on campus is special, though. There's for our student athletes that you're always excited about playing on campus. As you mentioned, the student population is going to be easily accessible. Tailgating per se is not going to happen, but we're looking at some tailgate-like options that we can set up, some kind of coordinated possibilities for people to gather before. A big question we get from a lot of people is how are you going to handle the parking? But the thing about the parking is, the Stan Sheriff Center is 10,000 seats. It's actually rated for 11,000 seats, and we have the parking sufficient for that. So in year one, I think we'll look at offering parking to all the ticket holders, and I think we should be okay. Once we go up to 15,000, if we get up to there, then we will have to look at like some park and rides, like using KCC or some other, like the Aloha Stadium uses Leeward for those options. But I think for year one, we should be pretty good for parking, just making a few tweaks and the way we just get the distribution of the parking to the ticket holders.
The time goes so fast. We're at the top of the hour already. I would like to get your closing thoughts. There's a lot of people, a lot of season ticket holders, and others who just would love to experience, we've been so starved for social connection. The idea of attending a game with thousands of other people is very appealing, even to people who are casual fans. What's your final message to the folks who are hoping to attend games in person and as you navigate all of this? Yeah,
well, first of all, no one's more excited than our student athletes to play in front of fans, as well as just ourselves. I mean, we ask for their patience as we learn. Our goal is to we'll be ready on September 4th. We feel we'll be better the second week than the first week, better the third week than the second week, and in year two we'll be even better. We're trying to make a special experience here, and Coach Graham has some great ideas about involving the student body in some of our activities during game week since we're on campus. But I ask for people's patience, and our fans, we've shown that for volleyball. They're the best in the country, and we've got such loyal and dedicated followers. And our goal is as quick as possible to get everyone who wants to be at our games there. And like I said, we're excited about being on campus. And every day I look out my window, and it's good when you see the progress going forward. Before it was the vision. Now we're actually seeing some shovels in the ground.
Well, that's great. David Matlin, thank you so much for joining us and updating us on that and everything that's happening there. We look forward to the fall and seeing sports back on the campus.
Thank you. Thank you both.
Aloha.
Thank you.
Well, exciting news there.
Yeah. Please go ahead.
Yeah, no, I think it is a challenge when you think about just the numbers that he talks about and the number of season ticket holders that are coming back from 2019 and the availability of seats. And so really encourage people, if you are a season ticket holder, as the athletic director said, that you should be receiving a letter in the mail to provide you more information about that. Maybe consider moving on up in that tier system, going to the All-American status, pumping a little more dollars into UH to help secure not only your seat, but of course to help the athletic department during this time. But it will be something that they have to navigate through. And they're putting together, they're trying to build a football stadium in half a year, essentially, which, if you know state projects, I mean, that in and of itself will be a miracle.
Yeah, it will. And, he pointed out the parking, and I didn't even think about that. But once he said it, to think about 9,000 seats, that's a lot of cars. So they have to figure that out. It does sound like they have the facilities to do that. They're navigating all of that. And the idea, that you could perhaps have to have some kind of a COVID test or some kind of vaccine verification. They're certainly not the only public venue that is trying to figure all of this out. And as he said, they're watching folks on the mainland to see best practices there and watch for that, because some of those protocols could be implemented at the university. Yeah,
so we'll continue to keep our eye on what happens there, and hoping for a great season and a new experience there on the lower campus. We're looking forward to the conversations. Next week, we have another full slate of guests coming up.
That's right. We have Lieutenant Governor Josh Green. I got to scroll down here. I know we've got Josh Green, and my computer won't scroll.
We have Josh Green. That's okay. It's Friday. We're ready to get out of here. We have Josh Green. We also have Dr. Libby Char from the State Department of Health, who will also be joining us, as well as Ann Eustaquio from the Department of Labor and Industrial Relations. Some changes have been made in the unemployment structure, so we're looking forward to that conversation.
Yeah, lots to talk about next week. We hope you have a great weekend. Until then, we'll see you Monday right back here, 10:30, with the Lieutenant Governor. Have a great weekend. Aloha.
Aloha.